Hello, everyone, and welcome to another episode of our Couch Conversations. I'm Dr. Jenny Cook, and today I'm here with the beautiful Edora. Edora has been one of my patients now for 8 years. We've been on quite a journey together, and today we're going to open up the conversation and unravel that a little bit more. But as a little bit of a plot spoiler, I'm just going to say that Edora and her husband welcomed their beautiful baby daughter about just over a year ago.
Yeah.
And we're going to talk about the events leading up to that. So thank you so much for being with us today, Edora. Can you remember back in 2018 what was going on in your life and when you first came to see me?
Yeah, absolutely. Back in 2018, my husband and I got married, and I'd always suffered with issues with my menstrual cycle, and so I knew I had been diagnosed with endometriosis, dysmenorrhea, polycystic ovaries, all of those sorts of things. So that's what I sort of initially had come to you with. I think at that stage I'd also had an abnormal cervical scan, so it looked likely that I needed to have surgery done. So I had laparoscopic surgery and a LET surgery, and I believe the advice back then was sort of, let's wait 6 to 12 months. And if you're looking to start a family, then having this surgery is, the pathway to
and
get
we've
you there.
certainly talked about endometriosis at length, and you went on and I did a laparoscopy, and we found stage 4 endometriosis, which I treated, and I said to you, this will have a positive impact on pain and fertility moving forward. And there was also that pap smear abnormality, and so we did a LETS procedure. And then tell me, how did you go after that? How were your periods after that? How was your pain?
Look, I'd say that they were still relatively heavy, not as horrible as they used to be.
Yeah.
The pain wasn't as bad as it used to be. I didn't need to be on medication for it. So life was manageable during the menstrual cycles. We did give ourselves sort of 6 months to sort of have a bit of a break, go on some trips before we sort of really talked about,
have a
do
life.
we want to start a family? So we wanted to enjoy our time together.
And just take me back, how old were you in 2018?
Good question. I would have been 32.
Okay, so that's a good age to be thinking about the fertility pathway.
Yeah.
I always encourage women to be proactive, and fertility would absolutely have been a part of that conversation.
Yeah, and which is something that I'm very proactive about with friends of mine, and anyone that's sort of considering having children or not. Just what they sort of need to think about for the future. So,
You just say get on with it.
Freeze your eggs is what I always say. Don't rush into it. Freeze your eggs is what I usually say. So especially if someone hasn't found the right partner or they're just uncertain whether they want to have children at all. And I say if there's a glimmer of a possibility that you might want to, freeze your eggs in your early 30s versus...
And keep that door open.
Yeah.
And did you go somewhere nice when you went travelling?
Yeah, we did quite a bit. We've done extensive travel. We've done a lot of Europe, US, Asia. So we actually had a 2.5-month honeymoon. So we did Iceland, Finland, Singapore, Dubai, like just everywhere. So it was just, it was like oh my God, our life's going to end. We're going to have a child.
Which is actually not the case, but we can talk about that later. And then you came back and said, let's do it. Let's try.
Yeah.
And you were trying for...
It was probably between 6 and 8 months.
Yeah.
And it was during that stage that we sort of, we're going to the GP, and I'd spoken to them about having had endometriosis and, spoke about, blood tests and things like that. And it had just so happened that my iron was something that my GP was curious about. And
I have to say your GP was very thorough to pick up on all of that.
Yeah, she is. She's someone that I still see to this day. So she was amazing.
Because if you had heavy bleeding and high iron stores, there's something going on.
Absolutely.
And she twigged to that.
Yep.
So what happened?
So she basically said, I'm not too certain, but I am, given that you are going to start, you want to have children, and if it hasn't happened in the last 6 to 8 months and you're likely going to go down the IVF route, let's just do a screening for hemochromatosis. She did that.
And I might just interrupt at that moment. So hemochromatosis is an iron storage disorder.
Yep. And so I came back as a carrier for the disorder. And so that's when she asked for my husband to also be tested. And he came back a carrier of the exact same gene disorder. And so that's what sort of led me to come to you, because we hadn't fallen pregnant. We knew that we were both carriers of this disorder. And it wasn't one after doing some research that I was too concerned about. But I think obviously through talking to you and the genetics counsellors, it was, well, if the chances are that you're carriers for this, it could be that you may or may not carry other disorders. Is it something you want to know about?
And so where did that lead you?
So we did the full genetic screening for both myself and my husband. It was a personal choice for us. It was at that stage we determined we hadn't fallen pregnant naturally. We were already going to start the IVF process. If this was just an extra step we needed to take, we decided that if it was I wouldn't call it a precaution, but if it was that extra step we needed to take to ensure we had the best quality of an embryo, then we were going to do it.
So what you're referring to is genetic carrier screening,
Yep.
which is, there's many different genetic tests you can do, but this is genetic carrier screening, which is a saliva test.
Yeah.
And the one that you did would have picked up maybe something like 400 of the most common mutations in our particular community. And where did that lead you then?
So it led us
You both did it at the same time.
Yeah, we both did it at the same time.
And you take a swab, you put it in an envelope, Australia Post takes care of it.
A couple of weeks later.
And sometimes it can be about 6 weeks later, something like that. Came back with an answer. And what did that show?
So it came back with an answer that both my husband and I were the carriers of the same genetic abnormality, which somehow related to deafness, which again, personally for me was not a major issue, but I think after speaking to the counsellors and understanding in more detail what that meant, it was a choice for us as to whether or not we wanted to screen embryos if we were lucky enough to get any through the IVF cycle.
Yeah. And the genetic counsellors, so we've got excellent genetic counsellors. Genetics is an area which has really completely opened up since I finished studying, and genetic counselling is a whole career which didn't exist before. They are trained to explain very complicated genetic abnormalities in very simple terms that anyone can understand. They are very highly skilled people.
Yeah.
And they really spelled out the whole spectrum of what it could be.
Yeah.
And one possibility was that it was just the baby, 25% of babies that you have the potential to carry 2 copies of the gene.
Yep.
But the way they are impacted could be very mild.
Yep.
Very mild hearing loss right up to complete deafness.
Yeah.
And it was impossible to predict.
Yeah.
So you were given the information and a decision to make.
Yeah, absolutely. And I guess for my husband and I, there was 2 decisions we made. We weren't going to stop naturally trying to fall pregnant. It hadn't happened for us. But if we were going to go down the IVF route, then we were going to add genetic testing to our IVF cycle. Personally, the way I felt and the way that my husband felt was that if we were going to be going down the IVF cycle, we wanted to give this future child the best chance at life, and not to question us at an older age. If you had a choice, why didn't you do this for me? So it was personal for us, and that's why we decided to go ahead with it. So, yeah.
Can you tell me a little bit about your experience with IVF? Do you remember?
Look, you sort of say to yourself, you forget once you've had your child, and I call her my dream child, and anyone that you sort of talk to, still there's that stigma when you say, oh, she's an IVF child, and they go, oh, and I say, why oh?
Yeah.
Like I would not change it for a thing. Like I look at it as such a distant memory, and I would do it 10 times over if it gave me the result that I got. And again, I'm that lucky individual who was blessed with a child. So, but it does, part of it becomes like a distant memory. I remember like the bloating, the injections, the hospital visits, all of that sort of stuff. But I guess personally for me, I've always say mentally I'm extremely strong, and I feel like my husband's a physically strong one. So I feel like it took a lot of meditation and a lot of just telling myself that there was going to be a positive outcome and reminding myself, even in the horrible days where we had bad results in the first few cycles that we went through, I wanted this child so bad that I was still at a point where I wasn't going to stop until I had that child. So I still had the mental energy.
I wouldn't have let you give up. You were, so I'm going to have to say then it was 2021, 2022. So you would have been 34, 35 at that point. I wouldn't have let you give up.
Yeah. And the one thing that always stuck in my mind, and I don't know whether you remember this, is that from the minute I saw you, you'd said to me, there's a 50-50 chance you're going to have a child. It's just a numbers game. It's just a numbers game, and it's just about timing and the right embryo. And I always had that in the back of my mind. It's going to happen. But I think for me, how I got through was I always said I want to live my life until that happens. And that's what we did. That's what got us through. We traveled, we bought a home. We did all of that stuff. We had quality time with one another because we were able to. And I feel like it was just destined that we were supposed to have this child the time that we did, because we appreciate it so much more. So it's,
And you can probably still go on your holidays as well, I would say.
They're just different.
Yeah.
More when they're infants. It's a lot easier when they're infants. When they're toddlers, not so easy, but yeah.
But there was actually two types of genetic testing that was done on those embryos, and this was where it starts to get confusing. But anyone doing IVF and with the thought that they might do genetic testing, it's something that you've got to get your head around. So the reason that this started was to test for a particular genetic mutation. But the second test we did was to screen the embryos to make sure they had the right complement of chromosomes, the right balance of genetic material, I suppose I could say, because it would be possible that the embryo did not carry that gene but was otherwise abnormal because it maybe was missing chromosome 1 and it was not going to work. So there was two genetic tests. It was only, the embryos were only biopsied once. But there was two genetic tests that were run. So
that, I think in saying that, there's one thing I'd add to that is that the level of confidence I had when it came time for transfer, knowing that we'd done both of those tests, it lowered the risk of potential miscarriage. And for me, being someone who hadn't fallen pregnant previously, that was always in the back of my mind. What if all of these other boxes were checked for me? But the fact that we had done that also meant that I had potentially a lesser chance of having miscarriage.
You're absolutely right. We know that it's associated, if you have a genetically normal embryo, it's associated with a higher term pregnancy rate and a lower risk of miscarriage. But you did do a couple of embryo transfers that didn't work.
So it was an attempt to do a transfer, but we medically cancelled the first time.
Okay, so, I don't remember that, but you obviously remember it.
So I think my uterine lining didn't thicken up.
Right.
It wasn't thick enough, and you didn't want to risk the embryo.
I would only ever put it back under perfect conditions.
And so I appreciated that. I mean, I was upset because I had my heart set on we're going to be pregnant and it's going to happen. But we waited, I think it was 2 months after that, and we managed to try again, and the uterine lining got thickened up and it was fine. And on the first actual transfer, it stuck. And so, we were blessed.
Oh, okay. So there wasn't a failed one. I cancelled it.
No, it was a medical, medically cancelled,
Okay, so it was the first transfer and it actually worked. And we rang you with the good news.
So... Well, I tested after 5 days.
Oh, okay, I didn't know that. You pretended that you didn't know the good news.
I walked in and she went, "You've tested yourself, haven't you?" And I had 20 tests in my bag, and I went,
Let me see your bag.
Of course I have. Like, how could I not? So I did test at home, but in saying that, the initial blood test came back with a low HCG. So we did have to wait again to retest after a few more days.
To make sure that it was rising
it was a viable pregnancy,
How did you feel when you were told by the genetics counsellor that any baby that you have has got a 25% chance of being affected by this gene and that they would be born deaf?
I was scared.
Yeah.
I was absolutely scared, confused as well, because you'll get asked, "Do you have anyone that's deaf in your family?" And you say no.
But you don't have anyone who's deaf in your family.
No one that was born deaf, no one that had any issues with that, and so it was confusing to me. And there's obviously certain things that you can and can't test for. We had hereditary heart disease in our family, but that's not something you could test for. So I was shocked, firstly, and I was also scared. Because, most parents, I can't speak for everyone, but you want to give your child the best chance at life. And so to think that because of something that's genetically inside me could impact my child, it's scary.
Yeah.
But again, not everybody knows this. Like, everyone's a carrier of something. It's just what are the chances you and your partner, are the carriers of the same disorders. And there's help out there if you need it or want it. So
women will often say to me, like, do I need to do genetic screening or what do I do about this? Is it important? And my answer is always, with genetics, I can never tell you because what is important to me is not important to you.
Exactly.
And what is important to you, I think, why are you worried about that? It's such an individual thing.
Yeah.
And, I mean, as you've said, as far as deafness goes, that people have very fulfilling lives.
Absolutely.
It is really just an individual thing.
Yeah.
And you've actually said that you were trying and you continued to try and accepted that you might actually conceive.
Yeah.
And can I ask, what steps would you have taken if you had this information and you'd conceived naturally? Yeah.
Look, I think there was two things that I had considered in my mind, and I think at the 20-week mark that we could do a test, but it also had high risks of potential miscarriage. I think I would have to be in the situation to actually know what I would do, but I knew that I had that as an option. I think the only reason why I would consider that is if I needed to prepare myself. If I had a child that had some hearing impairment.
You just want to know.
Yeah, I want to know, do I need to go to school and learn how to do sign? What do I need to know about the environment that they're growing up in, and what do I need to prepare myself for? On the flip, I would have also said, well, I can't change it. So what's the point of impacting a potential pregnancy? Why not just wait until the child is born and then test and then take the necessary steps to see what they are? Because I guess from my understanding, surgery can't be done right as they're born. They're not going to learn sign as soon as they're born. So you have an opportunity to do all of those things. So I guess I'd have to be in the situation to know exactly what I would do. I
understand what you're saying.
But I knew that I had those as options, and those also gave me comfort. And also knowing that there's a big community out there, and that,
there's a lot of support, available.
And again, the not knowing of whether this would be so minor that it was not life-altering whatsoever. Like, I don't know whether I would want to put myself through the stress of that during a pregnancy. I potentially would have wanted to have waited to see what the outcome was before I went ahead with 100 steps beyond that.
And I think that comes back to my point of genetics is such an individual thing.
It is, yeah.
And the genetics counsellors, as I've said, are very skilled. They are excellent at communicating complicated information in a very simple, easy to understand way, and helping to guide you with the answer that is right for you, to give you the information to let you go away and process it and make the right decision for you.
Yeah, absolutely.
I suppose I could say at this point, I could say a little bit more on genetic screening in Australia. Australia is a very regulated country, and genetic testing is very regulated. We are not legally able to to screen the sex of a baby. I mean, it is part of the test, but that is never part of the results. It's not communicated. The only time that we are able to disclose the sex of a child is if there's some sort of a sex-linked disorder, which has a significant impact on the quality of life, or, even associated with a lethal outcome, I suppose. Another one that I was involved with was a couple where there was severe autism, and it was more likely to happen if they had a girl, and we put it through the medical advisory committee. I think it was put through an ethics committee as well, and that one was passed.
Okay.
That one was considered okay. to genetically screen for
Did
sex,
they
and I
have
don't.
previous children that had
Severe autism.
Oh,
severe
yep,
autism,
yeah.
and but I couldn't tell you what the outcome of that was.
No, that's But that's interesting because I didn't know that one. So I did know, and again, obviously genetic testing was something new to me. I did know, I have a friend of mine who went through IVF where they had a same issue. They had to have, they didn't have to, but the female embryos were more affected with a genetic disorder, and so they opted to go with a male embryo.
But still they would have had to put that through, like to get special approval for that.
Yeah, absolutely. And then the only other alternative I knew of was if they were carriers of the breast cancer gene, and that's when you would opt
to. That's a common one.
Yeah,
that's you to screen for the BRCA1.
Yep.
And that's a fairly common genetic mutation that's accessible. But in other countries, there isn't that restriction on sex selection. It's called.
Yep.
There isn't that restriction, and look, that's just the way it is.
Yeah. Do you see that changing in Australia at all, or?
No, because I think now you're asking me questions. No, because we're a very regulated society, and there's a lot of rules about things, and I don't see that changing. Years ago, that wasn't regulated, and that's changed. It's not going to go back to what it was.
Yep.
I'm not going to say whether that's good or bad.
Yep.
That just is. That just is.
Yep.
When you decided to move ahead with IVF, which was largely because you hadn't conceived spontaneously after 12 months, and we started talking about genetic testing, how did you and your husband feel emotionally at that point? Where were you?
I think emotionally I always felt strong and good about it.
Yeah.
Positive is the word. And again, it comes back to your comment to me, and and it may have been the smallest of comments, but this is what I use when I talk to people about my journey when they ask, and I say to them, I was given hope. I wasn't someone that was ever told you've only got a 2% chance. And so that's why I still stayed positive about my potential outcome. I think if I was in a different category and if somebody had said to me, look, it's likely never going to happen, I don't think I would be as positive as I was. But I was lucky in the fact that I was given good odds. It hadn't happened naturally, but we had...
You're in your early 30s.
Yeah, absolutely. So mentally I felt good. I felt positive. Yeah. Obviously, the more cycles you go through, it takes a bit of a toll on you. But again, like I said, I had an end goal and I wasn't going to stop. And you wouldn't let me because you knew that there was going to be an outcome.
I knew that we could make it happen.
And I always used to say, it's a numbers game, baby. Like I'm going to get that. I'm going to get that baby. So it takes its toll. I think, to be fair, I think it was harder for my husband because he didn't understand the ins and outs of it. How it impacted me, I think, personally. And so sometimes I feel like he felt a little bit like on the outs, like, what can I do to help? What can I say? Yeah. There'd be times where he'd say something and I'd say, how dare you? Like, how ridiculous is that? And so there are.
And I do often worry that the men are left out of it.
Yeah.
Because you're put down on the appointment like it's your appointment, but he's actually a part of it as well.
Yeah. And I think because it is so technical also, and that's one thing that I will say that about the genetics counsellors, when he walked into that appointment, he was just like, I have no idea what is going on. But when we came out, it was simplified. We understood what the odds were, what the percentages were, what our options were. And he walked out thinking probably for the first time, okay, I now understand what's going on and what choices we have. So simplifying things is easier. I think especially for the significant other. I feel like the person going through the IVF is probably more researched and versed on it versus the person that's not and is just the support person. So it's and
look, it's a team effort as well. Do you remember the nurses? I mean, you've mentioned Andrea.
Yeah. She's been there since I think the beginning of my journey. So they're amazing. They're amazing. The encouragement they give you, the response time. It was great. It was a great experience. So, and you remember those people for a long time. So it's lovely.
The moment that you found out that you were pregnant.
Yeah.
So you actually
did the
did
naughty.
the test at home, but that's fine. That's fine. You were always the one who opened their Christmas presents before Christmas Day.
Absolutely. Yep.
And when you saw the 2 lines,
Look, I think because subconsciously I just said to myself, it's going to happen. This is my year and it's going to happen.
You just thought,
I thought, that's it. It's going to happen. And when I saw the line, I can't say that I got overly emotional. I think because I still understood that there was a process. So we still had to have a blood test. That had to have a good HCG level. I started to get excited when I started to do the test every single day after day 5, and the line got darker and darker and darker. I think the first day I did it, it was so faint. I had to hold it up to the light to make sure that it was double lined.
And that was where you came into Andre and she said, you've already tested, and you opened up your bag and said,
20 here,
yeah, there's 20 here. I've cleaned out the pharmacy. I'm guilty.
Yeah, absolutely.
That's a nice story.
Yeah. And I've still kept those to this day. So I still have them in the plastic bag, sealed, put away.
I love it.
I don't know why, but they're there. So, but it was complete joy beyond that. Like, it was just such a weight had been lifted. But I think in saying that also, it's understanding that every pregnancy is special. And there are risks that come along with pregnancy for both mother and baby. So I was still on edge until I got to every time I'd say, okay, until I get to 12 weeks, until I get to 20 weeks, until I get to 24 weeks. So, but I was happy. I was that annoyingly happy pregnant woman. So,
no, that's good.
Yeah.
And then you got to the other side of it, and you've got a beautiful baby girl now.
Yeah.
If you could talk to another couple about starting the journey, what would you say to them?
I think upon reflection is just to be patient, and to be patient with one another, because it does take its toll on any relationship. And I think really understanding what your options are and making sure that you're both on board with what your path is moving forward. Life is going to throw you curveballs. I know it sounds really silly, but I always say, like,
does.
like,
Nothing's
it's
silly.
just set low expectations, but have high hopes.
Oh, I love it.
Yeah, so I always had really, really high hopes, but I would always say to myself, with every egg retrieval, I'd say, I'll be happy with 5, but really in the back of my mind, I wanted 9 or 10. Yeah. And so when I'd come back with 8 or 9, I would be overjoyed by it, you know? So I think being patient with one another. Sometimes it takes time to get there, and then sometimes you get lucky and it's a short journey, and, you know, that's great. It's not an easy road. I think some people will say, I think there's people that sort of, you know, they think IVF for some people is a choice, and it's not an easy way out. It definitely takes its toll physically, mentally, emotionally. When I hear of women that have done numerous rounds of IVF, being someone that's gone through it, you have such a bigger respect for those individuals, because it takes its toll. You know what they've endured. So it's not for the faint-hearted.
And what about how would you recommend genetic carrier screening to everyone?
No. I have friends that are going through IVF or that have gone through IVF, and I've said to them personally, if there's no reason, then why? It's already such a long process. And if there's nothing that's been detected in your 30, 35, whatever years of life, then it's just it's not another road you need to go down, because you're already consumed with so much stress and pressure. It's not something I would recommend for everyone, but certainly if they had some sort of a concern, if they had some sort of disorder within the family, or they just didn't know their partner's family, that's when I would say it's an option. But again, it varies relationship to relationship or person to person whether they choose to go down that path.
I think that's probably the take-home message. And like I say, with genetics, it's an individual thing. You just make the decision that is right for you. But I mean, as you've pointed out, the vast majority of genetic mutations, there's no family history.
No.
You just have to make the decision about what is right to you. And so if you met someone who was doing IVF and they felt overwhelmed, what would be your message to them?
Just to breathe. Breathe. Might sound horrible, but you know,
That's
you're not
the truth.
It's the truth, and you're not the first person to go through this. You won't be the last. But try and enjoy the journey as much as you can, and think about the outcome at the end of it.
think about the
because
end
you
game.
will forget the pain and the trauma that you go through during the process once you get the reward at the end of it.
And what about the future for you?
Yeah.
Because there's...
I'm glad you're asking
Yeah.
me, not my husband, because he would say...
Oh, is that right?
He would say 7 more. We're having 7 more.
Oh, I thought you were going to say no more. He'd say 7 more.
He would say 7 more, and I'd say, good luck with the next 3 wives you have possibly, but not no. Look, I right now, today, am saying I want to enjoy and absorb every minute with my daughter. And I always said I wanted to give myself at least a year or 2 to just, because it took us so long to get there, I wanted to dedicate my everything to her.
Yeah, so I first met you in 2018. Now,
Yeah.
I suppose you weren't thinking about fertility straight away at that point, but she was born in 2024.
Yeah. And so she's 13 months now, and I'm still enjoying every minute of it.
Oh, that's lovely.
And if I didn't have any more children, my heart is so full. I don't mind. We do have another embryo. I think it'll take a lot of arm twisting for my husband and a bit of maybe changing more diapers in the middle of the night for me to agree to have another one because it is hard work. It's not easy, but maybe I'm leaving that door open. So you may or may not see me again for those reasons. So
I hope that I do see you again.
Yeah.
So I would like to thank you, Edora, for coming in to talk. I would like to acknowledge the strength and resilience that you showed. Thank you for sharing your story with me and with everyone else. Thank you for all those words of wisdom. Thank you for talking about just reinforcing the fact that genetic screening and IVF it's all about giving people choices,
yeah,
and leading towards a happy and safe outcome.
Thank you.
Thank you so much for your time today, and thank you to everyone else for listening.
Thank you for having me, and thank you for listening.